In March 2021, Evercare Hospital launched a first-of-its-kind 165-bed purpose-built hospital in Lagos, Nigeria. Over the past year, the hospital has achieved several milestones. Over 690 surgeries have been carried out, including a spine surgery and open heart surgery, and over 200 babies have safely been delivered in their care. The hospital celebrated its first birthday, hosting colleagues and stakeholders to an evening of recognition of these achievements. Arise correspondent Leila Johnson-Salami attended the event and sends in this report.
According to the Nigeria Sovereign Investment Authority, Nigerians spend over $1 billion annually on medical tourism. To help alleviate some of the burden triggered by outbound medical tourism, in 2021, the Evercare Group launched a first-of-its-kind 165-bed purpose-built hospital, with a range of specialty medical and surgical services in Lagos, Nigeria. Today, the hospital celebrates its first anniversary and the achievement of operational and clinical milestones.
While the journey to transforming healthcare is quite onerous and requires hard work, consistency, innovation, and collaboration from all the players, all of us, I make bold to say that over the last 12 months of operation, Evercare Hospital Lekki has raised the bar, and you have my commitment that we will continue to do so going forward.
The Evercare Group say their mission is to enable communities to thrive by providing patient-focused care and delivering top standards of patient safety, clinical excellence, and clinical outcomes.
This project was envisioned with a desire to provide high-quality, advanced healthcare services to the population of Nigeria. As we look to the future, we are happy to share our plans of developing new initiatives for our patients and community at large. These initiatives, the Evercare Plus and the Evercare Prestige, are both being developed for a launch in the second quarter of this year for the community in a bid to further improve patient experience and provide value add and benefits to the community.
And every breakthrough that we have made over the past year in clinical services, it is just one more stride towards us transforming healthcare. Every breakthrough in neurosurgery, every breakthrough in cardiothoracic surgery, every breakthrough in pediatric surgery that we have been able to establish over the past 12 months is just a stride that we are making towards transforming healthcare.
The healthcare infrastructure gap in Nigeria is large. While the global average number of hospital beds per 1,000 people is 2.7 beds, according to McKinsey, Nigeria currently has 0.9. Lagos State Health Commissioner Professor Akin Abayomi was in attendance and expressed the necessity of bridging this infrastructural gap through investments like this.
The government is doing their own role. What we are going to be doing is just setting the benchmarks. So we are building specialist facilities in, psychiatry, infectious diseases, oncology, mother and child care, cardiorenal centers. So we are doing that, but we're not going to be doing many. But once we set up the standard, then we expect that the private sector will go and fill the gap. Lagos is huge. The demand for healthcare is great. And what we want to see is, whether it's a government hospital or a private hospital, we want to see Lagos become the medical tourism destination of West Africa, if not sub-Saharan Africa.
The NSIA is an indirect investor in Evercare because we invested in with the main fund that launched Evercare Hospital. And so you'll see our logo at the Evercare Hospital, but it's an indirect investment for the NSIA. So I think it signals two things. One, it signals that we're seeing a return to what I believe is a heritage for Nigeria, which is actually competitive advantages in medicine. That's number one. Number two, it also means that we're at a point where we will start to have a reverse tourism. We're seeing it here. We're seeing it in other centers that we've been part of at NSIA. We're seeing people from West Africa coming to our center here.
When we started this journey in 2017, really our goal was to positively impact the healthcare landscape in Nigeria. And I think the one thing that I would say is we're well on our way to doing that, to transforming healthcare. And it's really all about providing access to quality and accessible care.
Access to healthcare is a fundamental right, and investing in healthcare is key for the best health outcomes. Through the delivery of high-quality and accessible services to communities in Lagos State and Nigeria, the Evercare Group hopes to ultimately position the country as a leading destination for inbound medical tourism. Leila Johnson Salami, Arise News, Lagos.